Do you know that 37% of all the oral cancers in the world happen in India? India accounts for about 9% of new head and neck cancer cases every year. It is second only to breast cancer in India, and it's the most common cancer among males in India. But do you know what the major reason for head and neck cancers is? And do you know that it is also preventable? So now let's talk about the causes of head and neck cancers. Smoking tobacco or smokeless tobacco. It accounts for about 70% of all the cases of head and neck cancers. The other reasons for head and neck cancers is consumption of alcohol, consumption of spicy food, persistent irritation, or poor oral hygiene. One of the most common cause of oral cancers in the Western countries is a human papilloma virus infection. Although it's very rare in India, but the number of cases of HPV associated cancers is increasing. Talking about the symptoms of head and neck cancers, if you have a non-healing and a painless ulcer in the oral cavity which does not heal for about 2 to 3 weeks, get yourself tested. It might be a hidden cancer. If there is any change in voice, if there is any swelling in the neck, you definitely need to consult a doctor and get your symptoms checked. Talking about the preventive measures, consumption of tobacco, as we all know, accounts for majority of the cases. So de-addiction plays a very important role in the prevention of such cancers. Also, we know that the effects of tobacco are not short-term, but they are long-term. So quitting tobacco does not nullify your chances of cancer immediately, but you should regularly go for your checkups. And last but not the least, it's a common misconception that it only happens in males, but this cancer is also found in a large number of females. So if you come across any female with such symptoms, they should be encouraged to get a checkup done.